fellow veterans, friends of veterans, family of veterans, and those of you who care about veterans in your lives or in general. I am Vicki Callahan. I'm the Deputy Chief of Staff at Kansas City VA Medical Center. I have been here since February of 2020. We've been through a lot this past year since February 2020 with COVID. I was finally starting to get to see the real Kansas City VA when the second or third or tertiary wave hit us again. So I want to tell you a little bit about Kansas City VA, the services we can offer to you, to your loved one, to someone you care about, to veterans who may not know that they are eligible for care or potentially eligible for care at the Kansas City VA. I myself am a Navy veteran. I was served in the Navy for 5 years, and I am also a care receiver at Kansas City VA. So I can speak to you from both the caregiver and care receiver side of the equation on this one. All right, with that, we're going to start some informational slides, and we'll go over some information and tell you a little bit more about KCVA to get you a little more familiar with what we can do, what we can offer, and hopefully get you to come see us. All right, so Kansas City VA opened in 1952. It was commissioned by President Truman, and legend has it that he wanted to see the KCVA on the Hill from his home in Independence. So that is why we are the hospital on the Hill. So opened in 1952, and we have a long, rich legacy of providing quality care to veterans in our catchment area. We consider it not only a privilege but an honor to take care of those who cared for this country in whatever manner they had to. So we are a specialty referral care center for western Missouri, southern Missouri, eastern Kansas, and we have emergency services available 24 hours a day. Our mission, of course, is to care for the veterans that choose and trust Kansas City VA for their care. Our vision is to honor America's veterans by providing exceptional health care that improves their health and well-being. And that's not just a statement. That is something that I think everyone who works at KCVA would say, that is why we're here, to serve our veterans. The VA is made up of a complexity designation model. Kansas City VA is designated as a 1B facility. 1A is the highest designation of complexity, which gives the ability to provide all levels of care. 1B is just slightly below that, and really we're only missing a couple of little services to be able to get to that 1A category, but we're not there yet. We anticipate growing into that at some point. We are authorized to have 187 medical, surgical, and psychiatric beds. We operate 9 community-based outpatient clinics throughout the Kansas City Metroplex and greater Kansas City area, and a radiation oncology area in Overland Park. CBOC is the designation for community-based outpatient clinic. That has actually been changed recently to VA clinic. So if you hear the term CBOC, all that means is an outpatient clinic that we use to service veterans outside of the main facility. Kansas City VA offers inpatient health coverage, outpatient health coverage, primary care, mental health, and specialty services. The specialty services range from everything from diabetic care to podiatry care to neurosurgical care to all sorts of other cares that I can't name off right at this particular second. The medical center provides primary and secondary treatment in general medicine and surgery, primary through tertiary levels of care in psychiatry, substance abuse, and PTSD, post-traumatic stress disorder treatment. Surgery services range from neurosurgical care to vascular to thoracic care, and we include everything from gynecological surgeries to general surgeries to podiatry surgeries as well. There are very few surgical options that we don't offer here at KCVA. We also offer advanced surgical treatments such as robotic care. We also offer acute psychiatric care, inpatient and outpatient, substance abuse treatment, and vocational rehabilitation services. Our outpatient services are many and wide-ranging. I will let you read through the slide here, but we offer basically many different services on an outpatient basis to include primary care, specialty care on both the medical side and the surgical side, mental health care, emergency services, PTSD coverage and service. There are several studies out there that state that the VA treats PTSD better than any other organization or medical services. We also provide social work services, whole health to include weight management. We provide geriatric services for our older veterans, spinal cord injury care, prosthetics, and again, vocational rehab. Our inpatient services, again, we offer everything from critical care, medical surgical care, psychiatry, cardiology, and others. This is back to our outpatient VA clinics. We have several throughout the greater Kansas City metro area and surrounding counties in Missouri and Kansas. Honor Annex is just down the way from the main hospital. We offer clinics at Belton, Cameron, Excelsior Springs, Nevada, Paola, Warrensburg, Shawnee, and we just very recently opened our Lenexa VA clinic. And if you get the opportunity to swing by that clinic, it is really very nice and very well done. Services provided at our community clinics. We offer primarily outpatient care and outpatient-oriented care at those clinics. Anywhere from basically any wartime activity. We have OEF and OIF primary care. We have general primary care. We have mental health coverage to include PTSD coverage. We have other mental health services. We also have some specialty services, such as cardiology attends many of our clinics. Orthopedics is engaging in several of our clinics. General surgery is engaging in several of our clinics. If you need to find out if you have a service offered at a clinic near you, please get in touch with us and ask what's available near you. Other services at our outpatient clinics include lab, radiology, teleretinal imaging, and pharmacy-directed chronic disease management. So these are things like what you might hear as Coumadin Clinic or other chronic disease management. KCVA was one of 18 sites selected to help lead the VA effort into transforming into the nation's most extensively integrated health organization system. And that's called High Reliability, or an HRO, High Reliability Organization. Basically, what being a high reliability organization means is that you can do a very complex task reliably and repeatedly over and over again without making mistakes. And that is what we hope to accomplish. High reliability is a journey, not a destination. And it is something that all of us strive toward daily. And I can tell you we have meetings about high reliability routinely. KCVA has grown a lot since I've been here in February. They've been growing longer than that, of course. But even since I've been here in February, we have deployed the Da Vinci robot-assisted system, which aids us with minimally invasive bariatric surgery, also can aid in cardiac and thoracic surgery, colorectal, gynecological surgery, and it's made a world of difference in the world of urology to include prostatectomies. It's made that surgery much better tolerated for our patients. We have also just recently opened a hybrid operating room this year. And what a hybrid operating room allows us to do is very complex vascular procedures with incredibly precise imaging. This allows for less invasive approaches to vascular interventions, and allows us to see into the vessels almost. It makes a complicated, long surgery much shorter and better tolerated by the patient. We have recently, during the pandemic, deployed the Abbott Alinity PCR analyzer, and this allows us to test for COVID rather than sending it off and getting the results 48 to 72 hours later. We can get the result usually within an hour and a half. This has dramatically improved our ability to take care of veterans and staff as well who are being tested for COVID. We have also, as many of you know, been very actively engaged in a vaccination campaign. To date, we have delivered over 50,000 vaccines to employees, veterans, and veterans' caregivers and loved ones as well. Many people don't know how engaged in research the VA as a system is. The VA is a cutting-edge research facility nationwide. At KCVA, we have over 170 active research projects. We have affiliations with 103 different academic affiliations and 80 schools, to include everything from medical schools, nursing schools, physical therapy schools, and all other sorts of schools that send their students to us. And as another point of interest, the VA opened in 1952. We had our very first medical resident in 1953, so it didn't take us long to get wrapped up in that endeavor. The Fisher House, which is home to people who are undergoing prolonged treatment and their families, is getting ready to open. They are finishing up construction. It looks like a beautiful facility from the outside. Hopefully they will get that opened up in the very near future. The Lenexa Clinic that I mentioned earlier, over 23,000 square feet, absolutely beautiful facility. Doesn't look like a healthcare facility. It looks like you're walking into a library. It's very nice. And again, we provide care to over 50,000 unique patients. These are the iCare values, and these are basically the values that all of the employees that work at KCVA and VA in general stand upon. And we build on these every day, and we trust our fellow colleagues to maintain these same values. And this is how and why we can provide the best care to our veterans. So the values are integrity, commitment, advocacy, respect, and excellence. I cannot tell you enough how strongly our employees at KCVA, how strongly they feel about these values and how important they are to them in regards to taking care of our veterans. Here's some numbers. If you are interested in enrollment or just hearing more information about whether or not you might be eligible, a local number is 816-922-2489. And again, the number's on the slide. If you have a loved one that you feel like might be eligible for care as well, please give this information to them. We have folks who are more than happy to talk to them about enrollment and what the Kansas City VA can offer to your loved one. I appreciate the time that you guys took to listen to this message and learn a little bit more about KCVA, and I hope to see some of your fresh faces, your loved ones with you. Those of you who have support groups, they're welcome to join you in your venture with KCVA. So thank you again, and have a good day.